speaking. How does the scar usually work? How long does that take to heal? And have you had any issues where there was abnormal scarring or any kind of puffiness from the procedure?
I think the scarring is usually very good because it's just a half moon incision right underneath there. With scarring, maximal phases of scarring, it's different from patient to patient. 4 to 6 weeks is usually when a scar looks its worst. If you have a ropey or a thick scar at that time, some steroid injection and our type of steroid injection into the scar will break the scar down and make it flatten faster. But I would say scarring is usually a fairly minor issue with these patients. The scar is usually quite good. Bodybuilders, they work hard on their body and they do have high levels of expectation, so that's part of this whole process. But I can't think. I have one scar that's kind of thick right now that I'd like to inject with some steroid, but that's about it. So if your scar gets thick and ropey, don't think there's nothing you can do. You can come in and get some steroid injection, some scar massage. Usually, I don't know what your experience was, but usually at 6 months, the scar is pretty well where it's going to be.
And does scarring vary by body type and or ethnicity, or do you notice it's flat across the board?
Well, I think any darker skin group is going to produce, in general, a darker scar. Filipinos can produce ropey scars on you at times. African Americans produce ropey scars. The nice thing is, though, it's not like a scar right in the middle of your arm. It's a scar at an area where there's a pigmentary change anyway. So if you go through a phase of scar color change, it's usually hidden by the areola. The times that I inject are if the scar is elevated, because an elevated scar you can slightly see. So an injection will flatten that scar out. I don't think the scar is really a big issue, and I think in patients where it is an issue, it's kind of a minor big issue. It's not a huge big issue. It's a manageable issue. It's an inconvenience. I mean, if you pick someone, also you can look at the scars elsewhere on their body. If you have an African American bodybuilder come in with a keloid scar on their arm, you know that they're more prone to do that. And you might say, hey, maybe for you, since you're a keloid scar former. So you can ask yourself, do I have scars elsewhere on my body? If they're ugly scars, then you can kind of think my scar might not be as great.
Okay.
So that's kind of something people can use to judge themselves also.